I'm Nicole Aguilar, an environmental health specialist, and I serve as the program manager for the consumer protection team. In Larimer County, the consumer protection team conducts the health inspections for restaurants, child cares, and K through 12 schools. Something that I really love about our program is that it impacts nearly every resident of the county. Whether you're grocery shopping, dining out, or enrolling your kiddos in school, it is our job to make sure that these establishments are healthy and safe. In Larimer County, we have a little over 2,000 retail food establishments, right around 250 child cares, and 120 K through 12 schools. Besides myself, our dedicated team includes 8 full-time field staff, 2 area supervisors, and 1 lead plan reviewer. Given our extensive responsibilities and limited resources, we prioritize education and collaboration to build a strong culture of food safety and general sanitation in these establishments. Because we are only in these establishments less than 1% of the time they're in actual operation, we know that each one of those interactions needs to be impactful and meaningful. Ultimately, our goals and the operator's goals are the same: to produce a quality product, be successful, and not put public health at risk. We consider ourselves a public health program with a regulatory component and not the other way around. Today, Tristan, one of the environmental health specialists on our team, will be giving you an inside look into the inspection process at one of our local restaurants.
Hi, how you going?
Good, thank you.
Hi, good. My name is Tristan with Larimer County Health Department. Here to conduct y'all's routine health inspection today.
Okay. Hi, Tristan.
Hi, nice
I'll
to meet you.
process that. Do you want to go back there now, or do you want him to come up here?
He's more than welcome to come up
Okay.
here. I'll put down my stuff real quick.
Perfect. I'll go get him.
Great, thank you. Hi, how you going?
Good, how are you?
I'm well. I'm Tristan with Larimer County Health Department.
Caesar. I know taco stuff. Welcome.
Excellent, nice. I'm here to conduct y'all's routine health inspection today. Could you go ahead and give me a tour of the kitchen, and we'll go ahead and get started?
Of course.
Great, awesome, thank you.
The first thing I always do when coming into any kitchen for an inspection is I always wash my own hands. Hand washing is very important in our line of work, whether it's myself or the staff that I'm going to be working with. Key times would be when they first start to work, anytime they touch their face or their hair, anytime they finish using the bathroom and then come back to the kitchen, they should definitely wash their hands and in the bathroom and back in the kitchen area. Anytime they handle any sort of raw product, and then between cleaning tasks. So if you clean something, take out the trash, mop, sweep, something like that, hand washing before you touch food. And then anytime you go from handling dirty dishes to handling clean dishes, there should be a hand wash.
All right, let's see if we got at least 135 or greater. Check a couple of these items here.
So when I check for holding temperatures, whether that's cold holding or hot holding, there are various equipments that do this for us. As far as hot holding temperatures, it's kind of the same thing. We want to make sure that they're only using that piece of equipment to hot hold that product at or above 135, and only use that equipment for what it's designed. I don't want to see anything that's below that 135. Any sort of reheating should be occurring on appropriate equipment, whether that's a stovetop or the microwave, and they're using the microwave properly to reheat. For cold holding temperatures, we're looking for anywhere between 41 and below. And then there is things specifically in the code that call out frozen, but the two temperatures that we care about is cold holding 41 or below, or hot holding 135 or higher. So in a walk-in cooler, there are multiple things that we're looking for. We're looking for date marking, so that's making sure that staff are recording the date of when that item was prepped or is being thawed from being frozen. Making sure that raw animal proteins are being stored by cook temperatures. We're also looking for any potential cold holding, and then also any potential cooling that could be occurring at that time. And if cooling is indeed occurring, we want to make sure that's occurring in shallow, preferably metal pans that are uncovered. Required amount of time for cooling is going from 135 to 70 degrees Fahrenheit in 2 hours, and then from 70 to 41 in the remaining 4 hours for a total of 6-hour cooling time.
Do you have separate cutting boards for fish or anything like that?
The way we do the fish, we cook it in the flat top.
Okay.
Pull it down in the water cooler.
Okay.
We have our area just for raw meat on this side.
Okay.
So regarding cross-contamination, we are looking to make sure that mainly raw food, like areas that raw foods are being prepared, aren't immediately then being used to prepare foods that aren't going to be cooked. So let's think like salads or garnishes for beverages or things like that. We also, in that same vein, it kind of covers potential allergen risks, although that's not a major thing that the food code calls out for. But we will look to make sure, at least if they're preparing fish, we want to make sure that they are indeed using it in a separate location. And then after that product is prepared, then those food utensils that were used are properly washed, rinsed, and sanitized after the fact. As far as in-use utensils and dishware is concerned, we are making sure that those specific pieces of equipment are being washed, rinsed, and sanitized at least every 4 hours. Whether that's through the 3-compartment sink in the 3-basin, where it's a wash, a rinse, sanitize, or through just a dish machine that does all 3 at once. So it does a wash, a rinse, and then a sanitize, depending on what it is.
Perfect.
David is going to show us how to
Yep, go for
do
it.
the process of cooking meat.
Okay.
So for adequate cooking, the cooking temperatures that we're looking for is 145 for whole muscle, 155 for ground beef or ground meat that isn't poultry, and then 165 for any poultry products. So when we look for cooking temperatures, ideally we're also looking at the line. And whenever we look at the line, we want to stand there for a good 10, 15 minutes. That's our main way of catching any potential hand washing, glove use violations, that kind of stuff. So if we stand on the cook line, ideally if they're busy, they're still doing their stuff. And then as we're looking for hand washing violations or good use of hand washing, good use of gloves, typically we're able to get a couple cooking temperatures. And we want to make sure that everything that's coming off the grill while we're looking at it is something that we're getting temped. That's how we make sure that things are cooking to where it needs to be the correct temperature. So once you finish cooking anything and you're going to be using it for later, ideally we want it to be cooled properly. So the way to cool properly is flat or shallow, anything no deeper than 2 to 3 inches, ideally 2, in metal containers that are uncovered in the walk-in cooler.
Right here. Perfect. Ah, it's
We
our
tried-
branded stuff. Excellent. Good
Try
stuff.
to keep it on the front because the servers are the ones
Yep.
who have to have the knowledge to know what to do immediately when that happens.
Nice. Great. And then who is your supplier for most of your food?
So, most of my food.
Yeah. Is
I
it
have-
like Cisco or is it like US Foods?
Greco. I have different
Okay.
vendors.
Yeah.
High Country Meats.
Yeah.
Greco, which is connected with Cisco
Yeah.
and Shamrock.
Okay.
Yeah.
Perfect. Great. That sounds awesome. Those all sound good.
The approved source is surprisingly one of the 5 main ways that people get sick when eating out. If you're getting your carne asada or any product for that matter, whether it's pizza, burritos, sushi from Joe Schmo down the street, as opposed to a reputable distributor, we want to make sure that they're indeed getting their food from a reputable distributor, or we at least know where it comes from. Like most meat that's processed has a USDA label on it that we know is good. If we find like an unmarked product that doesn't have what it's supposed to have on it, we will start asking questions as to where that product came from. And if it's not adequate, then that product has to go away. So after we finish the walkthrough of the inspection portion, I then will go and write up the report, typically on the laptop. And then once that is finished, then I have to present it to someone who is in charge. So ideally, the person that walked with me during the inspection, I'll present that report to them. We'll go over it. We've already probably spoken about a lot of the things that either were corrected on site or things that need to be corrected in the future, near future. And then from there, get them to sign off on it, send the report to them, and go on my merry way to the next one.
Hi, my name is Cesar Lopez. I'm the owner of the Taco Stop, and I want to share with you a little bit of the relation I have with the health department and how much have they helped us through all these years of growing. At first, it was a little bit scary when I heard inspections, when I see them around, but I realized that they're here to help us. We are responsible of the safety of a lot of people, and it wouldn't be possible to have this knowledge without them. You know, when I have an inspection now, I get excited because I like to know if I'm doing things right, and if I'm doing something wrong, correct them. Because like I said, we are responsible for the safety of a lot of people, and as a restaurant, I think that's our responsibility to make sure that we serve the best product and quality possible. And yeah, I'm happy to have them around and to help us on any way that we need to.